Liver cancer is on the rise in the U.S., and it's the sixth deadliest cancer. Dr. Arpana Kalyan is here to talk about the treatment called UHCC and how it helps liver cancer patients. Good morning.
Good morning. Thank you for having me. I'm delighted to be here and talk a little bit about this.
Well, there's so much to learn, and I want to read a quote from the material I received from you and have you comment on it. More than half of the patients diagnosed with this cancer are at advanced stages of the disease with poor prognosis. Why is that? Why are they not detected earlier?
Absolutely. So, when we think about liver cancer, because it's not so publicized, I think a lot of people don't know about it. Liver cancer kind of falls into two buckets. There's primary liver cancer, and then there's secondary liver cancer. We're going to talk a little bit about primary liver cancer today. So these are cancers that start in the liver itself. Now, as you mentioned, most patients, when they get diagnosed with this cancer, because it sort of sneaks up on you, it's been in your body for a while, and it's at a stage that's quite advanced, and we're not able to offer surgical means to manage the cancer or other local treatments. We're really reliant on IV treatments or what we call systemic therapies to kind of manage the cancer.
So this treatment that we're talking about today, UHCC, what is it exactly and who is it for?
So when we talk about UHCC, as you mentioned, it's really what it's saying is that it's unresectable hepatocellular carcinoma. So as I said before, there's most of the patients have cancers that are starting in the liver, and those patients are termed as having hepatocellular carcinoma. And UHCC just refers to patients who do not have a surgical option. So when we treat this with either oral or IV medications, we have multiple options that we can pick from. Now, immunotherapy as a whole has sort of revolutionized the way we treat cancers in general. And it's sort of exciting because now we have a viable, tolerable option for patients with unresectable hepatocellular carcinoma. So I'm delighted to be able to talk a little bit about this combination of Imfinzi and Imjudo with partnership with AstraZeneca. So this combination as a whole has actually been shown to have a reduction in risk of death by roughly 22% compared to what we used to have before. And that's really exciting for patients because this is now a viable, tolerable option in managing this cancer.
So, doctor, explain to us is this detected by screening? And if so, how do we know we need that screening?
Absolutely. So, the first step I always say is, have a conversation with your primary care doctor or your healthcare provider to see if this is something you need to be screened for. There are certain patients who do need to be screened, and there are very good screening tools that are available. And if your primary care provider is not sure if you should be, they can certainly refer you to a specialist, a hepatologist who is a liver doctor, to kind of have that conversation with you to see if that's something that you should be screened for. And once the screening starts, and if the cancer is detected, then you have a whole team that sort of is behind you to come up with the appropriate treatment to see if, perhaps Imfinzi and Imjudo is the right option for you or some other option.
Can you send our viewers to a website so they can learn more?
Absolutely. So, as mentioned before, talk to your primary care provider or healthcare provider to get the best information. You can also visit Imfinzi.com. So it's IMFINZI.com to get some information about the treatment that we just talked about. And it's important for patients to kind of know all of this information, and so they can advocate for themselves, because these are not appropriate for everybody, and we want patients to know that these are options available and they can discuss it with their provider.
I thank you so much for all of this life-saving information this morning.
Thank you for having me.